Hello everyone, this is Dr. Lata, your consultant obstetrician gynecologist here at Ankura Hospital, Kukatpalli. Today let's have a small talk on what is called the emergency contraception. Now, if you're worried about getting pregnant either because your general method of protection has failed or that you have had an unprotected intercourse, that's when you would think of emergency contraception, isn't it? Having said that, you might have heard of having these pills and getting them over the counter from the pharmacy. However, it's always essential to know that there are different kinds of emergency contraceptions available, and it's always ideal to discuss with your doctor about which one suits you the best, because it might vary based on your general factors like your weight on the BMI or based on your sexual health as well. Now, number one is the pills in itself, and again there are different kinds of pills. However, generally how they work is by preventing ovulation or the release of egg from the ovary and thereby preventing a pregnancy. Now, we always recommend that these pills should be taken as early as possible, ideally within 72 hours of having an unprotected intercourse. I would again like to emphasize that earlier the better, and again I would like to stress that these pills are not 100% protective, and there is still a chance of ending up with pregnancy even after having had this emergency contraception in the form of pills. Now again, these pills do not tend to protect against any further intercourse during the same cycle, or for that matter the subsequent cycles as well. Hence, it's always to be kept in mind that one course of emergency contraceptive pill only tends to protect against that particular episode of intercourse. Now, the second method of contraception that is available is what is called the copper T generally, and it's generally a small T-shaped device that is placed in your womb. It is made up of plastic and copper, and the way it acts is that it prevents the sperm and the egg from meeting and hence from forming a pregnancy, and also it makes the uterine atmosphere unfavorable for the pregnancy if it has formed to go and implant. Hence, it is much more effective and the efficacy is close to 99%. And one more advantage with this copper T is that it can be also continued to be used as a regular method of contraception. Having said this, I would like to stress again that meet with your doctor and discuss the one that is best suitable for you. Hope this helps. Thank you.